Thank you very much. And thanks everyone for having me here. I really appreciate it. It's exciting to talk to you about my PhD research at Bristol. As you mentioned, looking at motivational interviewing and whether it can be used by the veterinary profession. Under the supervision of Drs. Kristen Ryer, David Main, Becky Way, Anne Hayes and Emma Rowe, which is quite a lot, but it's an interdisciplinary project involving policy studies, psychology, animal welfare, and animal geography. So you can see it's a mishmash of a lot of things, but I'm hoping in a short time today to take you through a bit of an introduction as to why we were interested in the feasibility of motivational interviewing in this context, and then give you a bit of a whistle-stop tour on my PhD and the core questions I'm trying to answer to look at whether this is something applicable in terms of inspiring behaviour change in farmers on dairy cattle health and welfare. So why am I interested in this area? Well, my particular research focus is on lameness and mastitis, which are two endemic diseases in UK dairy herds. At any given time, a UK dairy cow, a third of UK dairy cows are going to be lame, and over your average year, half will experience clinical mastitis. So this is quite a significant welfare concern for these cows, but also an emotional and financial burden for the farmers that are looking after them. And although there's been huge amounts of scientific research on the risk factors and management strategies in their occurrence and how to adapt this information to on-farm practices, and those working in industry really do have the skill and expertise to do so, we're not really seeing a change in behaviour that matches this huge amount of scientific data. If you look at, for example, lameness over the past couple of decades, there really isn't a huge change. So what I wanted to know is, what are we missing? What is the gateway for this scientific information, and how can we perhaps improve this to enhance the uptake of advice on farm? And so my area of fascination is really this very small gateway where most of the information comes from, is this veterinarian-farmer relationship and the advisory services that are used to convey this information on a daily, fortnightly basis. But what's interesting when we think of the vet as the advisor, what they really get in terms of time with each farmer, as you can see from this very loosely prepared graph, but it's not based on exact data, but if you think your average UK veterinarian spends approximately 3 hours every couple of weeks with their farmer, and in this time they're doing fertility consults, PD checks, they're doing a lot of activities and often putting advice in with that at the same time. And what we're expecting from them in this probably 1% of the total time that farmer's doing things and behaving on farm is for them to be able to change their behaviour. And this is quite a tall order for even a behavioural psychologist, let alone veterinarians who really don't get the training in this. And the problems that we see really is that if you go through, as any of us in the room, we all are experts in our own field, and vets are experts in animal health and welfare, and they go through training and they are paid to provide people advice on cattle health and welfare, or in any veterinarian context, the welfare of those animals. And this leads to people being quite directive and having a paternalistic role, saying what to do and how to go about it. And you might say, well, what's the problem here? That farmer's paying him for that advice. Surely that makes sense. He will listen to it. But what we see when it's complex in behaviour change, and these diseases really are complex, there's no simple panacea, there's a lot going on for farmers to manage, that actually farmers become quite ambivalent. They might have good arguments for change. They might want to reduce the amount of lameness for the cow welfare in their herd. But at the same time, perhaps they're struggling with understanding which intervention has an output. As Claire said, these are very complex diseases, and no one behaviour can be predicted to have a direct output that's measurable. And when you have this ambivalence, what you see is when we come along and we try and help in the very way that we know how, by giving advice, telling people what the problem is, trying to fix it for them, we cause psychological reactance. When farmers have arguments for change and against change, and we come in arguing with this very helpful response on one side, we naturally evoke the other side of the argument. I don't know if you all think about reverse psychology, when you tell a child, you don't possibly want to go to bed. Oh, yes, I do. You can see this in kids. We do it as adults. We naturally respond with the opposite side of the argument because we have both sides ready. And this is the issue. What we also see is this directive response doesn't really protect those core aspects of motivation and self-determination that we need, of autonomy, self-efficacy, and a relationship between vet and farmer to underpin this. And this is why we went to motivational interviewing. We wanted to find a methodology that really addressed this directive communication style. Can we manage this a bit differently? And also manages the ambivalence of farmers. Now, this is an evidence-based methodology developed by these guys, Drs. Bill Miller and Steve Rolnick, actually in the 80s in the treatment of alcohol addiction. But it's since expanded into a huge methodology implemented in a lot of different areas of health sciences. And it's very much focused on eliciting behaviour change by helping clients resolve ambivalence. And it's built on the kind of Rogerian psychotherapy that some people have been talking about in a very client-centred model. And it's very much about building partnership, evoking empathy and compassion for clients as a core of the methodology. And there's two mechanisms of action in this. The first one is what I would call the technical hypothesis, that well summarised by this quote by Pascal, that's really that people are usually better persuaded by the reasons they've themselves discovered than those that come from the minds of others. And a lot of scientific data out there would support that when you have a lot of commitment language about change, when people personally vocalise about change in an interaction, they're more likely to implement that behaviour at 6-monthly, annually follow-ups. There's something so powerful in the psychology of talking about your own change. The second hypothesis is a relational one. And this comes back to what Reese Van Fleet was talking about earlier. She covered it in more complex detail than I have time for, but this idea that if you give someone complete acceptance and offer them, the facility to be okay with who they are, they become free to change. By offering partnership, collaboration, and empathy, you create a fertile ground for really creating engagement with a client. And so this is the kind of very brief introduction to the core ideas of the methodology. But what I wanted to know in my research was 3 core ideas about whether or not we could integrate with veterinary services. And these were really, how do veterans currently communicate on this matter? Do they already use MI or not? The second question was, how do they perceive communication advice and behaviour change? Does MI fit into the context that I'm perhaps trying to shape it to? Would it even work for a vet and their clients? And also, can vets learn and apply MI in a meaningful way? What does it mean in terms of doing it around cows rather than in a GP surgery, as MI is often used? And so my first more quantitative assessment was trying to get a handle on the types of verbal behaviours that we see in common behaviour change consultations between cattle veterinarians and their clients. So I asked 15 vets, it's a small study sample, but just to see if it reflected the wider literature on veterinary communication, to do some role-play consultations on behaviour change, on lameness and mastitis with an actress. And what I did is I analysed these using the Motivational Interviewing Treatment Integrity Scale. And this is basically a coding system for research interventions to look at the kind of verbal behaviours and whether or not they match MI practice. And to give you a broad idea of what I measured, this kind of intervention assessment looks at 3 types of behaviours. So ones that are non-adherent with MI, which would be persuasion, which is seen as kind of a violation of personal autonomy, and confrontation. Neutral behaviours, giving information, questioning, those kind of things, and specific skills related to MI. So this is very much those behaviours that particularly emphasise collaboration and partnership, client autonomy, and kind of active listening, reflections, and affirmations. And what you'd expect to see from the directive role that we most often take on in this kind of profession is a lot more of the persuasive arguments and the giving information and the questions. This is, again, our normal helping response. I stress it's not something that's necessarily negative or positive unless you look at it through an MI lens. And then what you'd hope to see from more MI adherent practice is these MI specific skills taking up as much as the MI neutral, but not the MI non-adherent. And so this is a graph showing the output of those 15 role-play interactions. So what we've got at the bottom is the total utterances of each participant. And as you can see, in the orange and the green are the kind of persuasion, giving information, and question that really were relied upon most readily in these interactions. And in the blue, you've got the spattering of the MI specific skills, the emphasising collaboration and autonomy. And what I'd like to just show you so you get a feel for what this means is a couple of examples. So this is an example of a reflective statement that I coded as a positive MI skill. When a farmer was talking up, basically saying, you've given me so many recommendations, I'm just thinking, oh my God, this is too much. The vet responded with, it's just one thing I'm trying to get you to do on top of everything else, and it becomes a bit overwhelming. This is quite a complex guess at what they're meaning, but he's trying to say, I've heard you, is this what you're telling me? Contrast this with persuasion. This was an example of a vet who just really wanted to say, we need to look at your mastitis. But they chose to present that actually, your cows aren't very clean, to be honest. I know that sounds a bit horrible, but they're a little bit dirty, and that's a big risk, so can we really take a look at this? And perhaps you can get a feel just from these quotes about the different kinds of effects these might have. One is very respectful and trying to build that relationship that we talk about, and one is perhaps how we would typically talk about things, but does more to bring a kind of confrontation to the interaction. And what was most interesting about this data is that actually, when we asked the actress to rate these interactions, she was blind to the fact I was looking at motivational interviewing. The ones that she rated as most likely to implement behaviour change on her part as a result of the interaction were these ones at the top here. And the ones that she rated as least likely were these at the bottom. So I just put this in because I didn't feel like I was measuring something abstract. It was something that she kind of felt that was important. And, this is something intuitive that's happening when these skills are used, because they are just the basics of behaviour. Everyone in this room has been talking about them. The wisdom really is in the room here. It's about partnership, collaboration, empathy. And MI is a way of formalising this, and this kind of showed in her response as well. So the skills aren't necessarily there, but they do naturally occur, which gives us promise. My next kind of question was, how do people perceive communication and behaviour change? So I carried out a qualitative research intervention where I interviewed 24 vets and their respective farmers. Hopefully I wanted to look at mastitis and lameness, but they were very semi-structured and ended up talking about all of herd health, just because I wanted real information about behaviour change. And I don't really have time to go into the complexity of these results. As you can imagine, it's quite a big study. There were some really interesting themes coming up on the relationships being important, the roles being important, the facets of communication and advice. But with regards to this narrative on motivational interviewing, what was really interesting is that farmers actually did say, trust is essential in this relationship, and empathy is a critical component of advice and behaviour change and all those interactions around it. They wanted to be listened to and to be worked in partnership with. And vets very much reflected this. They wanted to ask what the farmer wanted, to listen to what they had to say, and to empathise with them. So you might say, well, MI's already here, this is great, we don't really need to do much. But what was more fascinating is actually this working relationship that came out, that they mentioned as being entirely unique. One vet described it as a sacred bond, which I just thought was the most beautiful thing I've ever heard. But this relationship seemed to maybe shed light on why, despite these factors being really important, when you look at advice, they don't happen. And I mentioned a little bit about how in a role we tend to go to being quite directive to convey information. Well, the feeling of this close relationship and this empathy and this understanding was in everything that they did. They felt like the vet felt they were aware of farmer goals. They felt that they understood each other. But perhaps, as this vet kind of highlighted, that sometimes because of that, do you talk about the cows in quite as much detail and awareness as you should? And so when they have these advisory conversations, vets often jump into more directive styles about giving the advice that they're being paid for. But the feeling of relationships and trust and engagement is there because of every other conversation about the rugby and who was at the pub and whose family's doing what. And this really supports maybe why there's a mismatch between vet and farmer priorities when we look at actually how both report behaviour change on farm. So what I really wanted to take from this is, does MI fit? As a whistle-stop tour of those two studies, what I wanted to kind of get across that currently there was a bit of a deficit in skills. There's a much more facility for the specific verbal behaviours of motivational interviewing to be implemented. But there really was a congruence with the desired communication. Both vets and farmers reported these as important. They just perhaps have different ways of interacting depending on the type of conversation. And maybe MI could give vets the opportunity to shape through the particular verbal skills of open questions, reflections, summaries, and a set of consultation processes, a targeted way to think about bringing that empathy and that relationship into advice as well. So my research at the moment is really going to look at whether vets can learn MI. I spent a lot of time developing a training manual, adapting the motivational interviewing lessons and methodology and philosophy to the cattle veterinarian context, and I've been trying this both with students and organisations, with some people at the Brook that are here that were kind enough to have me. And what I've got is a training package that I'm taking out into practices, and I'm really asking them to record some data before I train them and after they train them on any advisory interaction on herd health that involves a discussion on behaviour change. And what I'm going to be doing is using the treatment integrity scale that I described at the start and looking at verbal behaviours in their interactions on advice on behaviour change before and after the training. And what I'm going to be looking for is, have they learnt these skills? But not only that, but what do these mean? So I mentioned a little bit about how the types of commitment language we see in advisory interactions can be predictive of later behaviour. And I'll be looking at farmer responses to these particular verbal behaviours and trying to understand whether they have more or less commitment language, more or less arguments in favour of the status quo, and what I could potentially hypothesise about the use of these skills in terms of influencing and inspiring behaviour change. And I really wanted to stress that this is obviously a form of influence, but we're not trying to encourage vets to do something to farmers. We're trying to do something with them. This is very much, again, about that partnership, autonomy, trying to empower farmers in conversations about behaviour change, and really just educating advisors to engage with them in this way, and to improve communication and thus, at the end of it, animal welfare, and particularly the welfare of the dairy cow. And I'm very passionate about this, and we're looking into the small animal side of things as well as other areas. And if your organisation is interested in this kind of methodology and what it might be able to do for you, do get in touch with my email there. We're very interested at where this could go and the opportunities it creates for creating better and more influential discussions on behaviour change in all aspects of animal health and welfare. And if anyone is interested, there's a lot of free information on the MI Network of Trainers website up there. And there's also a free module by the BMJ that talks through the methodology in much more clarity than I'm able to today, with videos that might be interesting to you. But I hope to thank the vets and farmers involved in the project and the cooperative who helped with recruitment. And yes, I hope it's given you a little bit of an overview of what I'm doing at the moment. Thanks very much.